The bill establishing the Delta State Health Scheme was signed to law in 2016 and activities started in 2017. 4 years on, the outcomes from the scheme highlight how Delta State has come closer to providing quality healthcare for all Deltans.
From the onset, it's designed to achieve the affordable quality healthcare to Deltans, where Deltans can walk into the hospital without paying a kobo off their pockets.
First key issue was reduce out-of-pocket payment by encouraging health insurance amongst the entire populace. But a significant key point was for us to ensure that the poor and the vulnerable had access to quality healthcare services. And that was why the first group of people we got enrolled into the scheme were pregnant women and children under 5.
To gain the trust of Deltans, the scheme enacted strategies to garner support.
When we got the draft bill from NHIS, we actually spent close to 6 months reviewing it because we didn't want to rush into it. Every state had its peculiarities. So we ensured that whatever we did was in line with the peculiarities of Delta State. So I give an instance. We had meetings with all unions. We had Okada riders, market women, civil servants, carpenters, plumbers, medical association. Wanted everybody, give us your input. If we want to do this, what suggestions and all that. So we had that very deep engagement with them. And it was all the information we got from that guided us in strategizing how we're going to carry on with our implementation program.
Commenting the scheme has improved the ability for Deltans to seek care and had a positive effect on health-seeking behavior of native Deltans.
Our environment, when people fall ill, instead of going to the hospital, they first go to the church, go to the chemist, treat themselves before they come to the hospital. One of the reasons is because they can't afford the care. But now, because they know that it's easily accessible, it's affordable, sometimes free even, that has made the health-seeking behavior of people to improve, and of course it has reflected in the overall survival of the populace. Under 5 mortality and maternal mortality, most especially, which are in the health indices in every population, has dropped.
To keep the contributory health scheme running effectively, the scheme has enacted checks and balances to ensure that the standard of care remains at a quality standard.
Contributory Health Commission has measurement indices as to the level of care, assessing the level of care a facility offers. So they have check and balances, and from time to time they come to do assessment of the health facility, and this has helped to keep everyone on their toes in terms of service delivery.
Creating a program that allows users to see a relatively quick response has helped people build government trust.
There's this mistrust of government programs. So through the scheme now, we've been able to address that challenge, because maybe some government programs previously may have failed, but this one is a program that you don't wait. It's not like pension that you have to wait for years to begin to see if the benefits will accrue or not. If you contribute 2, 3 months, 4 months, you may actually fall ill and need to use the services, and then you access care and you actually can see that, oh, this is actually working.
The health scheme has given me opportunity to be registered under the group medicals, of which if I am to go to any hospital, I would have been looking out for a general hospital and a smaller one. But the health scheme has given me the opportunity of registering in a hospital like this, where total care has been given to myself and every member of my family.
To ensure the sustainability of the scheme has built-in ways to ensure its continuity.
For every community we go to, we make sure that we get people from the community to go from house to house talking to people about health insurance scheme. We call them our liaison officers. They are also in those communities to interact with their people, just in case there are any health service challenges they have. They immediately report to us, we intervene and correct it. So it's a continuous engagement, and that continuous engagement that is positive is what will help it succeed.